So welcome back both to our audience here in the Knaufel Center and to those on Zoom. Our next panel explores gender and mental health in relation to adolescence. The moderator is Renee M. Johnson, Associate Professor at Johns Hopkins Bloomberg School of Public Health. She has published widely on the psychosocial factors that shape risks for the unhealthy use of alcohol and drugs by adolescents. And Professor Johnson, I'll pass the program to you.
So much. So I am a substance use researcher, and one thing that is often said in substance use research, especially by Nora Volkow, who heads the National Institute on Drug Abuse, is that addiction is a brain disease. And, I get the rationale for saying that, there was a real push to see substance use disorders as real diseases and to reduce stigma associated with them. But nonetheless, that phrase has always really bugged me. And it bugs me because diseases are more than what's under the skin. Mental disorders can be viewed as outcomes. They're really sort of what happens, the sum total of everything we put into people and all of the exposures that people are exposed to as they go through the world. So substance use disorder, as with other mental health issues, is strongly impacted by stressors and adversity. We can't reduce mental health, mental disorders, substance use disorders to something called a brain disease. So with all of that said, this session is going to address gender, mental health, and adolescence. And we are not reducing mental health among adolescents to what happens in our brains and under our skin. We're going to consider the contexts of adolescent mental health, and specifically the diverse contexts in which people live. We live in digital communities, we live in families, we live in social groups, we live and exist within a political structure, and we live and exist within historical systems of oppression. And across all of these contexts and other contexts that I didn't mention, there are factors that shape mental health. And in this session, what we will think about are how factors of cross contexts can be detrimental to mental health, or how factors can support mental health and enhance young people's ability to thrive. So I am eager to hear from our speakers today. We will hear from Tey Meadow, Teresa LaFromboise, Munmun De Choudhury, and that's it, those three people. Okay, so throughout their talks, well, first I'll say that information about these participants can be accessed through the conference webpage, so please do look them up. Audience members are welcome to submit questions at any time during the session. Whether you're watching in person or online, you can submit questions using the Slido link provided on the screen behind me and posted in the Zoom chat. So that box there is a URL, will lead to a URL. Okay, so we have one virtual participant and two in-person participants. So our first participant will be virtual, Dr. Teresa LaFromboise, and I invite you to begin. Teresa.
Great. Thank you very much for inviting me to be on this panel. I'm excited to be able to talk just so briefly about work that I've been doing for quite a while with Native American adolescents and suicide prevention intervention. And today I want to emphasize cultural and contextual considerations in Native American adolescent suicide prevention. And so we'll proceed. I'll just start. I'll try to get through these, slides pretty quickly so I can talk about what I really want to talk about, which is protective and risk factors in Native American communities. But this is from this information for the next few slides comes from the Youth Risk Behavior Survey, which many of you probably took when you were teenagers, and that of course is an ongoing marker, that a survey that's given in schools. And just to kind of get us started in terms of gender issues, that you can see here that there is definitely a significant difference between females and males in terms of persistent feelings of sadness or hopelessness in the past year. This is a slide by race and ethnicity, and you can see that the percentage of students in each of these groups in terms of persistent feelings of sadness or hopelessness has increased. And what I want to mention here is you'll notice that there are no Native Americans indicated here, and that's the case in a lot of studies because of the explanation is because of sample size, but here we have another example of that. And this is a figure that looks at the percentage of high school students who say that they've experienced poor mental health in the last 30 days. And if you look at the green bars by race and ethnicity, you will see that American Indian Alaska Natives have a higher rate, except for the case of multiracial individuals. And theirs is slightly higher than in this survey in terms of poor mental health. Now we're looking at suicide, and you might say, well, why in the world would somebody spend so much time on suicide? I began this work at the request of these Pueblo of Zuni, and I've continued to work in a number of communities, and certainly a lot of training of behavioral health specialists and paraprofessionals in delivering an intervention. But one of the reasons is obviously suicide is an end stage behavior. There's a lot of work that leads up to the risk behavior and the self-destruction. And also, I think of it, Michael Chandler talked about, suicide is like the miner's canary. Suicide, it marks the shifts from fresh air to poison gas in our political atmosphere. And in the case of Native Americans, I think it shows our treatment of Native Americans. It reflects the rise and fall of our democratic faith. And that's a quote by Felix Cohen, who was a noted scholar of Indian law, in his book, My Brother's Keeper. But I think it really says something about our society when we see these rates going up. This is you see the gender differences in terms of attempted suicide. Of course, this just verifies the gender paradox that, that girls or females tend to attempt and ideate more, but the males and tend, die by suicide at higher rates. This is the figures in terms of the percentage of high school students who have attempted in the last year. And so you see here that, again, American Indian Alaskan Native youth die by suicide or attempt at higher rates. And then this is the last image that you'll have. And this is what shows what is a unique pattern of suicidal rates among by ethnic group. And what you see here is that the pattern for Native Americans is really, a steep, escalation of the behavior until about, late, 25 to 29, until that later stage in the 20s. And then there's this, a steady decline as people age. But this is unique compared to the other ethnic groups. Now, what I want to really focus on is these critical contexts for prevention. And just, this is just, to try to emphasize the fact that prevention, school settings are good places for prevention. I really enjoy working with adolescents. And certainly in Indian communities, it's really the hub of where a lot of this work mental health works happens with adolescents. And these I want to go over just these risk factors, and then I'm going to balance it out with protective factors. I don't like to emphasize just the negativity, and there are incredible protective factors going on, but I like to categorize this sort of array of risk factors. There are many, but this array is based upon the research that we have right now with Native American adolescents. And I like to classify them into ecological factors, social factors, and individual factors. So let's start with historical trauma. These things that are always in the air. And really, in working in Indian communities, historical trauma has been a mantra in Native American mental health now for about 20 years, but it is on the minds of most everyone. And it's reactivated continuously. Right now, it's being reactivated by the recent discovery of graves near boarding schools. But clearly, for adolescents, the impact of boarding schools and the generational trauma that has come from that, and then the sort of baby, or basically the amount of adoption and foster care, of removing children from homes through the boarding schools or adoption and foster care. And that's, of course, being discussed and negotiated this probably by this summer with a recent case with the Supreme Court on the basically continuing or limiting the Indian Child Welfare Act. Pervasive poverty still going on all the time. And I think when you talk to youth and you ask them what's ever present, they'll just talk about downer, bummer, negative expectations. That's what they see, is just not much to look forward to in the air. And then, of course, in terms of social factors, there's a lot of violence and abuse that Native people experience. And I know it's not necessarily Native on Native violence. Of course, there is that, but also it is perpetuated a lot by non-Native people who live in community settings on reservations that, cannot be prosecuted by tribal courts if they enact or if they perpetrate violence upon a Native person. It has to be handled by, federal legislation. So there is this violence, and most people would say that it's been the Native on Native violence has been passed down through boarding schools, where children were taught to discipline other children, and before that kind of behavior really wasn't prevalent. Suicidal contagion, with the rate of suicide being for adolescents being 3 times that of the mainstream population. It's very common for youth to have friends that pass away, because of the close-knit nature of extended families, to have family members that die by suicide. And of course, in small, communities where everyone knows one another, people are affected by the deaths that go on. In terms of discrimination and bullying, we're really talking about the impact of the bullying could be happening, Native on Native in schools, but also in realizing that 70% of Native American students do not, go to school in mainstream or border town settings. That more or less is probably perpetuated by other groups. And then, of course, we know the prevalence of discrimination just all through the United States and other countries as well. Right. Then, of course, the typical individual factors that we think about in the mental health field: depression, early onset of substance use, higher rates of psychological disorder, poor health conditions. And I add gender orientation here because it is definitely something that affects the rates of suicide ideation, suicide attempt, as you saw even from if you had time to see it on the slides for the Youth Risk Behavior Survey. What's exciting to me is that there is now some research on protective factors for Native American adolescents and suicide. And I want to turn you to a systematic review of research by Angela Wigglesworth and her team just recently on protective factors, studies of protective factors for attempted suicide. And I've kind of classified them in those three buckets again. But basically, cultural continuity. We know that if people feel that the culture is alive and thriving, that people will want to live. This is sort of the thinking of Michael Chandler, who was a developmental psychologist who wrote extensively on that. Culturally based spiritual orientations. The mantra now in Native American mental health a lot is culture as prevention, culture as treatment. Culture heals. So many, but there's a lot of ceremonial work going on, and this seems to be really making a big difference. We even have some studies now in terms of the uplift that people experience when they are beginning to learn their primary language. Learning to be able to introduce oneself in language, being able to say, some conversational work. People that go operate in language nests to be able to reclaim the language. Exciting. And of course, the opportunities to engage in traditional activities are really increasing in Native communities and in urban settings. In terms of the social factors, we know that the sense of connectedness, the sense that parents know where their children are, that they have high expectations for them, that there are many people that care for me, and parental pro-social norms. Also feeling that teachers and people at school care about me, those kinds of connectedness. So social factors are coming up in the literature as protective factors. And then the individual factors of just feeling upbeat mood, positive self-image, and better physical and mental health. And then now there's beginning to work on life purpose, the role of purpose in life and how that protects against suicide with Native American adolescents. So finally, I just want to say that there are many Native youth have benefited from these school and community-based suicide prevention interventions, and they are increasing. I emphasize again the important role of culture as treatment, and that is very prevalent across Indian country. And although we have beginning to have more family involvement and community-wide change strategies for suicide prevention, that is increasing. It is really understudied compared to this work that I've mentioned to you on the individual risk and protective factors. So I think I'll leave it with that. Thank you.
Thank you so much. That gave me lots to think about. Our next speaker is Munmun De Choudhury.
Hello, everybody. I'm incredibly honored and pleased to have a chance to speak with you today. Thank you, Radcliffe, for making it happen. In my brief presentation today, I'll take the opportunity to talk to you about some of the work that my collaborators, my students, and myself, we have been conducting over the past few years that is showcasing the computational potential of digital trace data, particularly that from social media, in order for us to better reason about mental health and what this novel approach can tell us about beginning to tackle gender and gender-related disparities that exist in the world today. The question of how do we go about addressing mental health issues is not a new one. It has existed almost since antiquity, except that our answers have evolved over the years, across cultures and across millennia, and we have adapted those answers as our understanding of the human condition has changed, whether it is in the face of science, of medicine, of chemistry, of psychology, and most recently, of technology. But if you look back, humans have actually tried for the last 7,000 years to cure and treat those suffering from a mental illness. The history and evolution of mental health concerns is unfortunately not a very flattering story. But the reason I mention this is because it does explain a great deal about why the landscape looks the way it does today and where it could possibly go next. Let's look at a couple of paradigms. So psychoanalysis, as all of you know, it was the first scientific paradigm of mental health, and it originated in the work of renowned social psychologist Sigmund Freud back in the end of the 19th century. And then came this pharmacological treatments in mental health, and we saw two paradigms emerge. One in which we saw clinicians and researchers who started to adopt a biological paradigm, and then a second in which we saw learning behavioral and cognitive scientists who began to regard the person as a learner who actively interprets their situation, and that gave rise to the widely acclaimed cognitive behavioral therapy. So what these paradigms tell us is that we have indeed come a long way. We are no longer trying to relieve people of evil spirits. We are not trying to put people in asylums or conducting lobotomies. But why are we even talking about all of this today? That's because even today, there's a lot of work to do. We have widely prevalent social stigma, we have systemic barriers, and we have deep-seated disparities that are continuing to fail our efforts to help people with these struggles. And one of the contributors of those disparities happens to be gender and gender identity. So in the language of Thomas Kuhn, and me as a computer scientist, I ask, could the current digital and computing revolution, could it serve to close some of these gaps? And could potentially help us think about what could be the next paradigm shift when it comes to mental health? Speaking of the digital and computing revolution, let's talk about social media in particular, and why is that relevant to mental health? If you think about mental health struggles, we know that a lot of them are characterized by many latent processes, and that includes things like different perspectives, positive and negative, self-focused attention, loss of self-worth and self-esteem, and social disengagement. Today, with social media platforms, many of these latent processes can be recorded in the present because we are constantly using these tools, these platforms, and they can be recorded longitudinally. At the same time, social media are very much a part of many people's lives, especially adolescents and children. And people are increasingly appropriating these platforms so that they could talk candidly about their mental health and well-being challenges in a way that was not possible before. And that includes socially minoritized as well as marginalized groups, such as women and LGBTQ+. Consequently, my work over the past decade, it has shown that if we look to social media, we now have an opportunity. And that opportunity lies in starting to think about questions of improving mental health diagnosis, of influencing the trajectory of mental health treatment, and importantly, being able to now connect people with timely care at a scale and capacity like was not possible so far. For instance, here on this slide, we developed a social media-based index of major depression, and we found that it could mimic pretty well the prevalence of the condition given in the American Behavioral Risk Factor Surveillance Survey, and that gave both face and concurrent validity to this novel data source. But as United Nations Millennium Development Goals, all the way back that was established in 2000 would note, addressing mental health challenges with or without social media would be incomplete if we do not also recognize that large-scale cultural, social, economic, demographical, and political processes are underlying differential health risks in the global population. In fact, it's established, as Dr. Johnson mentioned earlier, that rarely does biology alone act to determine health inequities. So in the context of mental health in particular, gender and gender identity-based differences are significant. And these differences may emanate from a biomedical, a social, an economic, and an epidemiological perspective. In fact, if we consider LGBTQ+ individuals, such individuals, they are known to suffer disproportionately greater health disparities, and mental health is one of them, as we heard this morning. They're 3 times more likely than others to experience a mental health challenge, and approximately 31% of LGBTQ+ older adults report major depressive symptoms, and 39% of them report serious thoughts of taking their own lives. But in spite of these known challenges, if we look at our current mechanisms of assessment, where do they come from? Surveys, national economic accounts, institutional records, health records. These data sources often do not capture very well the lives of these minoritized individuals, whether it's women, girls, or that of LGBTQ+ populations. Moreover, if we look at developmental indicators at national scales, they do not emphasize these differences well enough. And at the same time, if we look at methods of how we reason about mental health challenges, they are also inconsistent. So what do we need? We need higher frequency of assessment so that we can understand changes in mental health experiences across gender and gender identity groups. And we need consistent methods of assessments to go about doing them over time. Online and social media data provide one such opportunity to meet these needs. As we will see in the remainder of my presentation, they can help us understand the experiences of these marginalized individuals better and think about imagining better care and intervention strategies. Given this context, let us examine two threads of work that we have been involved in. First of which looks at how can we develop a better understanding of how females and males disclose mental illnesses online, such as on social media platforms. To answer this, we looked at publicly shared Twitter data over an entire year that spanned millions of postings and filtered those individuals who stated that they have been diagnosed with a form of mental illness. In the table that you see in the slide, you see some examples of what these disclosures of men and women in this data look like. To understand gender differences, we then identified self-reported gender by looking at the biographies that these individuals wrote on the Twitter platform. And then we performed statistical comparisons between disclosures of these two gender groups. So let's see what we found. As you can see from these quotes, compared to male Twitter users, they expressed more negative affect and anger in their social media postings. Female users, on the other hand, used more positive affect in their writings on Twitter. We also found that there was increased use of first-person singular pronouns in the postings of male Twitter users, and that showed a self-focused behavior and disclosure of personal stories. But unlike females, male users did show a detachment from social conversations and a hesitation to seek for help. And as observed earlier, females did show a positive outlook, motivational spirit to cope with mental health challenges on Twitter, and a desire for disclosure and health seeking on this semi-anonymous platform. Prior work has shown that women tend to rely more on the social support, their social networks of their families and their communities, rather than the individual. And also, we know that adherence to traditional gender roles prevent males from candid disclosures of distress. And our findings from social media resonate with these. But with social media, now we have an opportunity to quantify these differences and imagine technological interventions that can be gender aware, which can also encourage differential forms of private or anonymous help seeking among different gender groups. More on that soon. So turning our attention to the second thread that I brought up earlier, disparities based on gender identities, we know that LGBTQ+ individuals experience stigma, prejudice, and discrimination that in turn creates a hostile and stressful environment for them that is detrimental to their mental health. Minority stress theory is one such approach to begin to understand these psychological stresses. There's a need to understand the causes and correlates of minority stressors and what kind of those stressors might be manifested when we talk about online social media platforms. To answer that question, we looked again to a different social media platform, in this case, online communities on Reddit. We looked at the LGBT subreddit on that platform, which includes hundreds of thousands of subscribers today and includes thousands of postings that come from individuals identifying with these identities. Overall, we saw that a wide range of minority stressors are present on social media, and some of them are prevalent across groups within the LGBTQ+ community. For instance, anxiety about not being able to be accepted socially or being victims of discriminatory actions. But we also saw that on social media, some minority stressors were perpetuated by some subsets of the LGBTQ+ population, such as stigma or prejudice that were perpetuated from cisgender LGBTQ+ people to trans people, or violence that was perpetuated from gay individuals to bisexual people. But we did see a sense of belonging in this community, and people were more open to expressing their self-experiences and minority stressors because they were looking for help. What these results tell us is that from a public health perspective, we need new kinds of technologies and communication channels if we want to raise awareness and educate individuals. And social media could be one mechanism for us to understand these minoritized experiences and create opportunities of challenging the contributors of minority stress. What we heard in this work is that we can also think about guiding future minority stress research, or think about identifying causes and correlates of minority stress going forward. But like with the previous study, we can also think about interventions that happen on social media platforms. For instance, can we think about having trusted peers in these communities who could be connected to information, who could be knowledgeable about these issues, and who could provide a helping hand and an ear to listen to these individual struggles. Again, we can imagine social media to be that resource where help-seeking and maybe even teletherapy could be incorporated with appropriate moderation and support-seeking efforts. I'll quickly close here. These sound promising, I'm sure, to you, but I would recognize that there are far too many questions for us to answer still. And these are questions of ethics and harms. And many of these are, we have to recognize, are populations who are marginalized. And we have to recognize that social media traditionally is not a source of health data. It has its own biases stemming from, for instance, digital divide or self-censorship. So how do we move forward from here so that we can weigh in the positives of these digital technologies while at the same time working to mitigate their harms? Thank you very much.
Thank you, Munmun. Okay, Tey Meadow. We're so pleased to have your talk, and this is the final of 3 talks in this session.
I just want to start by thanking the Radcliffe Institute for having me here. So Donna reached out to me through Twitter this fall and asked if we could talk. I learned that though he was assigned female at birth, strangers had always assumed her child Jack was a boy since he was a toddler. He preferred boys' clothing, boys' ways of being, boys' interests and hobbies for his whole life. Jack said he might be gay in kindergarten, but by the time he was in 3rd grade, he was identifying openly as transgender, first to peers and then to Donna. Jack struggled with depression at times, and it intensified when puberty hit. After months of research and over a year of supportive psychotherapy, Donna took Jack to an endocrinologist in 2021 when he was 14 years old, and he began a regimen of puberty blockers and cross-hormone therapy. His depression abated, he was happy and thriving. Right around that time, the generally conservative political climate in Texas was intensifying. That same spring, the legislature introduced 16 bills seeking to ban trans youth from competitive sports, from bathrooms, from gender-segregated school environments, and to prohibit gender-affirming health care. As public discussions ensued, Jack began to experience harassment at his formerly warm and supportive school, but from peers and even from some teaching staff. The family found threatening notes on their car. The local children's hospital halted their gender-conforming care provision. Donna was spit on by an angry mob while leaving a legislative session in which she testified against the sports bill. Then, the Governor Greg Abbott threatened removal of trans children from supportive parents, and she panicked. What if Jack fell off his longboard and broke his arm? Could she safely bring him to a hospital? When I met Donna on Zoom last November, she and Jack had been living in a Colorado neighborhood for almost 4 months. Jack was 16, nearing the end of his first semester at a new school, and they were both trying to adjust to life hundreds of miles from Jack's father, stepfather, and brother. He liked his new school. He appeared for a moment in the Zoom frame while Donna and I were talking. He smiled at me and he ran his hand through his hair. He was on his way to the zoo with friends. Texas has now introduced 57 anti-trans measures. Jack is finishing up his first year in Colorado. The family is still separated as his stepfather continues to job hunt from Texas. Then, on January 23rd of this year, Colorado introduced its own anti-trans sports bill, the Women's Rights in Athletics Act, and the cycle of worry began anew. This is a terrifying time to be LGBTQ in America. The ACLU is tracking 469 anti-LGBT legislative measures across the 50 states, restricting free speech, access to health care, access to equitable public accommodations in schools, athletics, and libraries. Among those threatened are LGBT people ourselves, parents, family members, teachers, coaches, physicians, and psychologists. The most virulent of these laws specifically target minors and the adults who care for them. I'm going to confine my remarks today to the area of this legislation about which I'm most frequently called to comment, those which target trans and gender nonconforming children, adolescents, their families, and care providers. In the 2023 legislative session alone, that's in the last 3 months, Republican lawmakers have introduced more than 100 new bills specifically targeting trans youth. This is part of a coordinated, multi-state attack on transgender Americans about which there is open and very public acknowledgement. At CPAC last month, Tom Fitton, the president of Judicial Watch, called trans-affirming care, quote, a demonic assault on the innocence of our children. Conservative commentator Michael Knowles added, there can be no middle way in dealing with transgenderism. It's all or nothing. Transgenderism must be eradicated from public life entirely. Many of us know about some of these laws from local and national media coverage on specific issues, opinion pieces about the legitimacy of medical transition for adolescents and what to do with athletes in elite competitive sports. But as Ezra Klein writes for the New York Times, most people are unaware of the sheer scale and cruelty of the current legal landscape. As we sit here discussing gender and mental health, there is a vicious attempt to eradicate transgender America underway, and this is not an exaggeration. Legislation currently up for consideration seems to target almost everything it means to be a person in the world. Some measures seek to enshrine draconian biological definitions of male and female in a variety of contexts and to prohibit legal name and gender changes on official documents. Some allow for religiously motivated discrimination in housing, employment, and accommodations. Some even ban mentioning of transgender people, lives, and identities in schools and in public libraries. Some threaten felony prosecution for medical doctors and therapists who provide affirmative care to youth. Teachers, doctors, and psychologists risk losing their livelihoods, their licenses. Parents risk losing their children for allowing them to live openly as transgender. A subset of this legislation targets medicine and health directly. Right now, a total of 13 states have a total or partial ban, and another 2 states have governor decrees which threaten a similar effect. 10 of these passed in the last 3 months alone. In some of these states, children immediately lost access to medication they may have been taking for months or even years. In others, they have been given a short grace period to either taper off the medication or to seek treatment out of state. Families are scrambling to move, leave schools, jobs, and communities. They are crossing state lines for care for which they must pay out of pocket. Some are considering black market options despite having health insurance that covers the medications they need in other states. You can read about these bans in every major newspaper. And if you look, you'll see medical and psychiatric governing boards like the AMA and the APA, major human rights organizations, policymakers, researchers like myself, and parent activists scrambling to speak back in what has become an impossible rhetorical landscape. Now, let's be clear about one thing from the start. Affirmation and support does not endanger the well-being of trans and gender nonconforming youth. The media may make it seem like a debate, but it isn't. A litany of social and medical science suggests precisely the opposite. Trans youth who receive support from their families, peers, and communities look a lot like cisgender children. They have similar levels of self-esteem, they're no more likely to be depressed than their peers, even their gender development mirrors that of cisgender youth who share their gender identities. It's when they lack access to support, access to gender-appropriate facilities and medical care, and when they fear for their emotional, material, and bodily safety that trans youth suffer. And this is precisely what is happening right now. There is near consensus among actual experts on these youth on the negative impacts of these politicized efforts, not to mention the public rituals of humiliation and exposure they require for families seeking to counter them. Conservative politicians know that political orientation is a proxy for perspective on trans acceptance, making trans youth an expedient vehicle for showcasing one's conservatism. This is most evident when you consider that the proposed bills and government mandates contravene the public advice of every major medical and psychiatric governing board in the United States. Because I have a microphone and because you have to listen, here are the facts. Trans people in both red and blue states suffer disproportionate poverty, unemployment, homelessness, violence, family rejection, discrimination, and exclusion, and the predictable emotional and psychiatric effects of what we've been talking about today, minority stress. Affirmative medical and psychiatric care can dramatically improve the psychological health of both transgender youth and adults. For example, for trans youth aged 13 to 20, gender-affirming care, including puberty blockers, hormones, and associated psychological supports, reduce rates of moderate and severe depression by 60% and suicidality by 73% in as little as 12 months. These benefits persist over a lifetime. Transgender medicine is a well-developed body of practice. Puberty blockers are safe, and they have been used on children since the late 1960s. We know exactly how they work. Hormone therapy allows adolescents with cross-gender identities to experience puberty alongside their cisgender peers. An international medical consensus supports social transition for young trans-identified youth and age-appropriate medical transition for transgender-identified adolescents. There are a small number of detractors. It's not a debate. In the words of the editors of Scientific American, quote, "These anti-trans bills are also anti-science." What's more, trans youth themselves are watching this happen. Children are not unaware of both interpersonal enactments and structural disadvantage. They are salient features of social life for youth, things they think about, talk about, and worry about. They set the conditions within which they can imagine livable lives for themselves. We are doing irreparable harm. Finally, and this is something I've been thinking about a lot this year, these bills are designed to do more than silence transgender lives. They are designed to make it rhetorically impossible to simply assume that transgender people, particularly trans and gender nonconforming youth, have a basic right to exist, to be loved, and to participate openly in their communities. Part of how homo and cissexism work, homosexism? What is homosexism? That'll be my next book. Because it does exist, actually. Okay. Part of how hetero and cissexism work is to set the contours of public debate. LGBT Americans, our families, our service providers must constantly struggle to legitimate our realities in the eyes of others, most consequentially, in the eyes of those who seek to prohibit, prescribe, and punish LGBTQ ways of living. This requires us to sit in an always responsive position to a discourse that seeks as its open and explicit mission to harm us. As a sociologist who studies gender and sexual diversity in a very broad sense, I have repeatedly stalled newer projects to assist families in conflict with schools, communities, and care providers. I've been called in to do crisis management in schools and corporations. I've been approached to publish opinion pieces arguing for the same positions publicly held by medical and psychiatric organizations, to produce the penultimate string site to support the idea that the identities of trans and gender nonconforming youth are valid, that they're unlikely to change, that they are just like the other sets of feelings, desires, and self-understandings young children can absolutely know they have, that affirmative medical and psychiatric care is the only appropriate and responsible option, and that literal decades of literature demonstrates both the social success of transitioned youth and the absolutely catastrophic emotional, educational, social tolls of non-acceptance. This is settled science that can be unsettled anew by anyone seeking to bolster a conservative political persona. This conversation is infinitely renewable, and I fear an endless hamster wheel ahead of all of us. This is not merely a waste of emotional and material resources. It forestalls continued work on the nuances of affirmative care. I know clinicians who are too worried about self-protection to provide care to their patients, to follow up with previous patients, and to research new and better positive interventions. Researchers like myself cannot move on to new projects and cannot count on continuing to find open and willing pools of participants in conservative environments. Most importantly, our own work lives, once outward-looking and creatively driven, become subsumed by a constant race to rescue individuals from microclimates of abuse. Beyond that, and this is something many of us admit only privately, it's emotionally exhausting. The discourse of scientific debate exacts a heavy emotional toll on those of us who do this work and identify as LGBTQ. I can speak from firsthand experience and tell you that the introduction of these laws exacts a psychic violence on all of us called forth to defend our identities, communities, and ways of living, to withstand accusations of impartiality and undesirability, to argue dispassionately for our right to exist and for the rights of those we study and serve, to comfort our terrified students, colleagues, and research participants, to explain this world and its cruelty to our own children. I wish I had a more positive note to end on, but instead I'll ask you to help me create one. If you don't know very much about the lives of transgender Americans, it's time to learn. When you imagine where to spend your time politically or intellectually, work to assist those of us fighting for youth to have basic access to schools, to medical care, to free speech, and to their own identities. At minimum, check in with your transgender friends and neighbors and colleagues and ask how we're doing. Ask us how you can help. Thank you.
Thank you for that really important talk. Okay, so we've had 3 very compelling presentations, and at this point, I wanted to just begin to have a bit of a discussion with our 3 speakers. And I think what I'll do, because Tey, your talk was so powerful, is sort of think about Munmun and Tey's talks and consider how we can vision a context in which trans youth can grow up and see themselves as having happy lives and feeling loved and fulfilled. I was reminded of this very small, this is random, line in a chorus line when they were, talking about this part. They all wanted to get a part in the play, and there was a gay man, and he just said he was so sad when he realized he was gay because it meant he would have to be a bum for the rest of his life. And that, I don't know, all these years, that quotation stuck out to me, and I feel like there's a line there with what Tey was talking about, and that is children are listening, and it's important to consider how we talk and how we make sure that they can envision a wonderful life for them. So I wanted to pose the question to Munmun and to Tey about how can maybe digital spaces help us reach people, particularly within the context of this virulent anti-trans period that we're in. So why don't we start with you, Munmun, and then move to Tey?
As a technologist for a long time, I used to be an optimist. And I used to think that that a lot of these digital technologies are gonna help us reimagine better futures. I'm no longer as much of an optimist anymore. But that said, I think we have work cut out for us going forward in terms of we now understand that there are good things that these digital spaces can offer when it comes to marginalized folks, like trans folks, like LGBTQ plus folks, but we also have work to do in terms of mitigating harms. And this cannot be work of one set of stakeholders. We have to all work together to make that happen. We have evidence, and Tey was talking about the science that is behind a lot of these. It's backed by science that these individuals can go to social media and online platforms and find support. And there is also evidence that when they do that, sometimes they're harassed and trolled, and their experiences dismissed by others. So the question for us is that how do we amplify the positive features of these digital spaces together with a multi-stakeholder approach, and what can we do to mitigate those harms?
Yeah, I'm not going to be the world's biggest optimist here either. I think, first of all, that the presence of social media is being actively used against trans youth. There are a lot of, when discussions happen in state legislatures around these measures, one of the contentions is that trans identities and gender nonconforming identities in youth are a byproduct of social contagion, and that the internet is the major producer of trans identities in youth. And this is not true, but it's difficult because we all know, anybody who I have an adolescent child myself, and the internet is not a safe place for anybody, right? The more you say on the internet, the more likely you are to be abused by someone somehow. And ultimately, I think that our primary targets have to be the adults that are constraining the possibilities for trans youth to live openly. And that's really where we need to be putting our time and attention, is making it no longer acceptable to make these sorts of allegations, right? Trans youth will create worlds for themselves. They've been doing it for generations. We just need to get people off their backs.
Munmun, might there be some strategies or policies that offer a framework for oversight of digital media in a way that changes the conversation? And I don't know what that looks like, but some basic, you can't lie about this form of medical treatment. Is there anything on the horizon that would change the game like that?
Thank you for that very important question. I think first and foremost, we need to think about what can hold a lot of these tech social media platforms accountable to keeping these digital spaces safe. Currently, we don't have any sort of, oversight to make sure that indeed happens, and we have left it up to the companies to decide what they do at all, if at all, for harmful content that a lot of these populations experience online. I think top-down policy is a potential path forward, and there are many suggestions that I have heard from scholars across the board, like what we did for tobacco companies years ago in terms of it coming with a disclaimer. So one idea could be to have disclaimers in using these platforms that can highlight these harms. But also it's a little bit different from the situation with tobacco in that there are some positives that are obviously possible with these platforms. So the question is, how do we design policy to make these actors, the tech companies, accountable that tackle some of these negatives? And we have some good examples on the horizon in the European Union with some newer legislation that is coming around harms of AI. I think we have some good examples to draw upon from there.
Thank you. I wanted to bring Teresa into this conversation and think about historical trauma and connecting that to trauma that we are causing to people and populations today. So you talked about historical trauma among American Indian groups, boarding schools, adoption policies, basically making American Indians no longer Indians. I spent some time in North Dakota and I hung out with a lot of kids. In fact, I became friends with the adults there because all of their kids would just come to my house and play, and then they were like, well, you must be okay if my kid is playing at your house. But I remember this one little girl. I was conflicted about going to public places, museums, and things like that there because of this history of hatred toward American Indians. And there was like a Custer Museum or some war site, and I mentioned it, and this little girl said to me, "He used to kill little Indian kids." And that, I thought, was some iteration of something she must have heard over time from parents and grandparents. And I live in Baltimore, and one of my former students is a Baltimore native. He talks about growing up in Baltimore and saying you never wanted to walk by Hopkins because one of the researchers would pick you up and put you in an experiment. So I feel like young people hear all of this trauma. Children are listening, as Tey mentioned. And I wanted to hear about what are some policies to repair some aspects of those historical traumas, and what kind of initiatives should people be thinking about, advocating for, and knowing about?
That's a really good question. And glad that you are in North Dakota. That's where I began teaching when I was a young person. And my daughter's enrolled on the Turtle Mountain Chippewa Reservation, Turtle Mountain Chippewa tribe. Right. I don't know if you were there, but anyway, It's a great place. Yep. I don't know that there are so many formal policies. I think that what is going on is it's an ever-present awareness. And when I spent quite a bit of time working in South Dakota with many of the tribes there, and what was always clear to me in traveling there is that even you just pick up a local newspaper and listen to the text or read the text, and you hear the language of historical trauma constantly. I teach a course in American Indian Alaska Native mental health at Stanford, and just in class 2 days ago, one of the Dene students talked about being challenged in a power course because she mentioned historical trauma, and the professor just sort of broke it down. Okay, how old are you? How old is your younger brother or sister? Give me an age. What are they learning in school? What does historical trauma have to do with that? And she was devastated because the professor didn't want to acknowledge that it's still a reality. I think people think it's time to get over it and don't talk about it anymore. Some of the policies really, I think, are more activism in a way, in terms of working at renaming, working towards and hoping that there would be, but it may be unrealistic to ever have reparations. I think the emphasis on culture as treatment is an excellent example, because actually, in a way, many communities and professionals insisted and pressured, in a way, SAMHSA to be able to say you have to think about and do include traditional practices, because they have been effective. Time has been, the marker that these practices still do work. And the knowledge that, indigenous knowledge is important. And we don't always have to go, bow to the requirement of evidence-based interventions designed on mainstream society as being, the guide for our interventions. Yeah. And so, if you don't want to support our traditional practices, then, we don't really need to be engaged in this partnership. And I've seen a big change in terms of more openness to help support the collaboration between more traditional practices and what we know about many interventions. So I think some of it is really the work of constantly having a voice and asserting it, and really struggling against mechanisms that are, really would rather overlook and forget that Native people exist. So I'm not a legal scholar, so I can't really say that, but certainly all the work that we're trying to do around awareness for the rights of Native children in light of the Supreme Court, case that's being decided upon at this time is another good example. So I think that'd be the best way to answer it. It's just ongoing reminders that this is, even though it's historical, there's still contemporary trauma, and a lot of the contemporary trauma is exacerbated by people that want to ignore the historical.
Absolutely. The worrying about, reverse racism becomes more important than actual racism. That's an issue. I do love the mantra culture as prevention. I think it, in my mind, reflects the idea of Black Lives Matter and pride in queer communities, survival and community. And I think before we turn to audience questions, which I'll do in just a second, I thought, Tey, perhaps you wanted to take a moment and see if, and just talk if there is anything in the, culture heals, culture is prevention framework that maybe resonates with you in terms of your work with trans youth.
Yeah, I mean, I love that question. It really does. And I think, many of us who are queer came into community with deep joy at a certain point and realized that there were different ways of living and being than we had experienced as children that felt authentic, that felt like places we could bring our whole selves. And imagine how sad and scary it is to look at trans youth, to look at queer youth, and to think, if I tried to bring this child into an adult queer space, what would that look like, right? What would that look like to people for whom queer lives are invalid? So we imagine that we can just share culture with children, but you can't go see Drag Queen Story Hour in many states in this country anymore. We are hiding queer adults from children. We are hiding trans adults from children. We are hiding livable lives from children who need to be seeing and experiencing them. And Michael Warner wrote about this, 25 years ago in a book called The Trouble with Normal, that the way that heteronormativity works is to make queer lives unthinkable, to have children grow up in a context in which those ways of living, it's not just that they're prohibited, it's that they're made to not exist. And so each individual child lives with a sense of inarticulate difference until they can come into community, until they can come to see the things that they think and feel represented in happy, successful, loved adults. So I really believe that this mantra applies. And I also see the structural and political barriers to achieving them as being particular in the case of queer and trans kids, right? Because we can't bring something that is seen as sexual into contact with children, right? It must be hidden. It must be unspoken or unspeakable.
Thank you. Okay, so I'm going to move to audience questions. And this question, I think, is very important to address because I've seen it a lot, and it is a misconception. Are rates of gay and trans youth increasing today? I guess that means the rates of young people who identify as sexual minority or gender minority compared with prior generations? And if so, what are the factors that give rise to this? And I think I'll supplement this question with how have sexual minority and gender minority young people been seen or not seen in previous generations compared to today? So we'll stick with you, Tey, to address this.
Yeah, I mean, if I want to tell the truth, which I do, the answer is we have no idea, because we don't know how many gay people there are, and we don't know how many trans people there are, and we didn't know then, and we don't know now. And part of this shift in a rhetorical framework that I want to introduce today, which I call, kind of like, what if it's just okay to be trans? Like, what if that's just fine, right? And that's the baseline assumption from which all conversations proceed, right? Then we can acknowledge all of the nuances of the complexity of gender and sexual identities in life, the assumption that they're going to remain static over a life course. So I think about Lisa Diamond's work, the psychologist, on women's sexual fluidity, and the ways in which sexual orientation, desires, identities can shift over the life course, that actually happens to a predictable number of people. How many? We don't know, right? So I think that it's kind of like the allegations that children with gay parents are more likely to be gay. And so we're supposed to say no, right? Because we're supposed to assume that there's a predictable number of homosexuals in the world that are going to be homosexual, and so we can't make more, right? And we wouldn't because that's like a suboptimal outcome. I think being gay is great. It's really worked out for me. So I don't know about that assumption, but I also would say, like, of course they are, because they live in a landscape in which this is a possibility. And I think that this is what conservatives are so afraid of, that if we say it's okay to be trans, that trans people will actually live. And so, we really can't know. My tongue-in-cheek answer is I hope so.
So this is just a note to folks who are sending in questions. I am seeing some questions that are really uninformed and are sort of reifying some of the things that Tey talked about. And we're not going to disturb the dignity of this presentation by responding to them, but I do encourage you to read the science, read a book. I think we have an author of a book here, and so I'm just going to keep going then. So what I would also like to do is bring Munmun into this conversation and Teresa a bit and talk about climate change and just this idea of indigenous communities, fossil fuels, conservation, and the digital-based activism that's been going on there. So the specific question is, how can we include the intersection of extractive industry, especially fossil fuels, in the conversation about trauma on all timescales in Native communities? And I think what this person is saying is that it's an environmental justice question that we have historically in this country and around the globe, taken from indigenous and marginalized communities, and how are we fighting that? So maybe Munmun, you could start, and we'll move to Teresa.
I think the social media is one of those places where the types of information we see on the climate crisis kind of go in two different extremes. We see advocates who want to fight it, but at the same time, we see a lot of misinformation. And I think much damage is happening from that misinformation. I wouldn't even stop at calling it misinformation. I think there are powerful forces that are engaging in disinformation campaigns on these platforms, often supported financially by the fossil fuel industry. But a lot of these are invisible to people. And I have seen educated, otherwise liberal people who don't believe in the climate change crisis I think there is much work to do in bringing more transparency to the financial incentives behind the way these digital platforms work and what information gets promoted, whose voices get suppressed, what gets amplified, because I think much harm is happening from looking at some of these disinformation on social media, and we are losing the battle on the public opinion front there.
And Teresa, I wonder if you could talk about Native youth, American Indian youth, and their participation. I know they had, especially at Standing Rock in North Dakota, a real role in some of the activism against pipelines, and how that might be influencing their own development and mental health.
Oh, well, thank you for that question. I think I'd like to just respond to your first question.
Sure, please.
About the, about the, in terms of environmental issues and the extraction of and destruction of land and how this affects gender. First of all, just in terms of the thinking and ways of knowing, the land is always referred to as Mother Earth, and the land is sacred. And so the effort in fracking and these pipelines and this kind of work is, attacking women, it's attacking Mother Earth. And it's very real in terms of the impact that it's had on missing and murdered Indigenous relatives. We used to say missing and murdered Indigenous women, but now we're more open and think, because we know that it affects, not only women in terms of the exploitation of women and the death of women, and how this is affecting the mental health of all people, Native people. When people can die, and the authorities really don't spend much time trying to find a body, prosecute the person, or they can go free, or because they can't be found, or they're not going to spend enough time really trying to find people. It's very devastating, I think, for women, for Native women. Young girls are very afraid to walk on the roads, to go jogging, to take rides with people, and so with the pipeline, I mean, basically we had man camps that were just came up very quickly, and the exploitation of women around there, and other people that were vulnerable to being exploited was tremendous. So that's one aspect of it. Another is that because of this environmental degradation, there are Indigenous communities in Alaska and along the coastline in the lower 48 that will be displaced. Another form of displacement. Yeah. Whenever communities are just going to have to move because they can't live where in the area that they've been in for generations. So I think of it that way. And yes, youth are getting very involved. They were very involved in at Standing Rock, and it was very exciting to see people, youth from all over the country to come there. And I think in a way that, of course, that's empowering, right? That people are gathering, and there's that kind of energy again. It's sort of like, since Wounded Knee uprising, and in the when was that? The 70s? Yeah. I mean, that's 50 years ago, right? That, we have another movement. And I think that is helping with leadership among communities for youth and older people, the adult generation as well. But I just don't want to let this thing go about missing and murdered Indigenous relatives. It's really sad that, people can't feel comfortable in their environment without knowing that they could be, just taken away and killed. So to me, that all goes together.
Thank you. So I think we are pretty much out of time. I'll just say, adolescents developmentally have a really strong motivation to ensure fairness and justice. And it is important for us as adults to enable them to strive for a world that is fair and just. And I am really heartened by what our speakers have said today, and disheartened in other ways. But it's important that we, continue to make a better world for young people and offer them the tools that they need so that they can also make the world better. Thank you so much for your participation. I look forward to your continued scholarship. Thank you.
Well, thanks to all of you for this really profound discussion of the many contexts that implicate and affect mental health in adolescents, and we appreciate it.